This is Fox 26 Morning News at 7 a.m.
The Dallas Cowboys are without starting quarterback Tony Romo because of a spinal injury. He hit the ground hard in the team's last preseason game. Romo said he felt good later in the game. Doctors and trainers soon realized, though, the injury was more serious than Romo thought. This morning, I'm with orthopedic surgeon Dr. Howard Cotler from Gulf Coast Spine Care to talk about spinal injuries, as September is Spinal Cord Injury Awareness Month. Good morning to you. Thanks for being here to talk about this. And obviously, not many people are NFL football players, but injuries like that can happen elsewhere. How often do you hear someone say, I didn't think it was that serious?
Fortunately, it's very rare that that happens. The most common injuries for the regular person is sort of a muscle injury, sciatica, or some spinal stenosis. It's very rare that someone will get a spine fracture or a massive disc herniation, like some of these traumatic episodes have been occurring in football.
How does it surprise you, the fact that he said, I didn't think it was that bad, and it turns out to be a pretty serious injury?
Well, Tony's had injuries in the past. He's had 2 other spinal injuries previously and has had spine surgery. These hits are very hard and they're very fast.
Well, we're all watching football, it seems, right now. It's always exciting the first of the season, and of course we're cheering on those Texans as well. J.J. Watt also had spinal trouble, having surgery this summer. His was a lesser injury, though, than Romo's?
Well, he had a disc herniation, and we aren't really sure about whether he had any neurologic deficit. A lot of times when we see patients come into our office, they have diseases that have been going on for many months and, in fact, many years. Fortunately, he was attended to immediately right on the, by the medical staff and then promptly treated. And that was able to get him back in the game very quickly.
That is so important, to figure it out quickly and not injure it even further. What is the difference, I guess, if somebody comes in, or even if they're at home, how can they tell the difference between, oh, my aching back, I hurt my back, and no, I actually hurt my spine? Exactly.
What you worry about is neurologic deficit, any numbness, tingling, weakness, pain, paralysis, things like that. That requires a more immediate or urgent evaluation.
It seems like treatments are getting less invasive as well?
They are. They're becoming much more less invasive, and in fact, a lot of the surgeries that I do, people only spend one night or in the hospital, or sometimes they even go home the same day. So that's very efficient. We couple that with an accelerated recovery program, and people are able to return, just like J.J. Watt, back to activities, usually within 4 to 6 weeks.
Recovery time is crucial. I'm so glad you said that, because we have come so far. I think a lot of people ignore the symptoms because they think there's no way that I can take off that much time for work. But as you said, when you do rehab and different things like that, you can get back on your feet a lot faster, can't you?
The most important thing is to get evaluated very promptly. Usually a benign condition will get better in a week or 2. If it does not, you need to be evaluated very promptly, then treated promptly, and everybody wants to avoid surgery, but if you need surgery, get on down the road and start getting better and on to recovery.
Okay, and just quickly, it's hard to sometimes figure out what all's going on, but you wrote some simple books, so to speak, for the layman who could actually get what's going on with himself, right?
That's correct.
Okay, thanks for bringing those in. We'll check them out and we'll try to get those on our website.
Great.
Good to see you here today. Thanks, Dr. Cotler. Tom.